In the race to vaccinate, Pfizer could be close to asking regulators to authorize its COVID vaccine for children under 5. And those shots could be available by the end of the month. If approved, children as young as 6 months would be eligible for a shot. Unlike adults, children that young will have to go to a doctor to get their shots, and they may need more than 2 doses. NBC 10's Deanna Durante breaks it all down for us.
I have 4 children, 3 of them are eligible to be vaccinated.
When it came to getting doses for her and her husband, Kelly Loren says it was a no-brainer.
We don't think twice about any of their other vaccinations that they get, but again, for some reason, we were just a little hesitant, maybe because it's new, but we did do it, and we're glad that we did it.
And for her youngest child, she says it will be a talk with her pediatrician on whether or not her 1-year-old will get the dose.
My 6-year-old vaxxed. We did it through the Colonial School District. His second shot was December 7th, so we were good for the holidays. And my almost 4-year-old, I'll definitely get vaxxed.
We caught up with parents outside of Lafayette Hill Preschool to get thoughts on what they will do once the vaccine is approved for children as young as 6 months.
I think it's the only way that we're going to get past this whole pandemic. I think, so many of the younger kids present with just colds and have spread it, to a bunch of other kids and possibly parents and siblings.
For pediatricians like Dr. Daniel Seelig of Andorra Pediatrics, there is no question the vaccine works. At the same time, he knows for parents, there will still be uncertainty, especially, he says, since many think kids do not get as sick as adults when they get COVID.
I've had 2 kids that have had it, and they both ended up in the ICU. Thankfully, they were both fine, but it was scary for 24 hours. I'm not willing to take the chance that your kid is not going to be that 1%.
Now, federal guidelines call for kids that young, 6 months old and up, to get their doses of vaccines at their providers' offices, like their doctors. Seelig says he knows that's going to mean that they need to staff up. He also says that it could also mean, because the doses are so small, that kids that young may need a 3rd dose down the road. In Andorra, Deanna Durante, NBC 10 News.